I'm Judith Gates, a trustee for Head for Change, and I've been asked to talk about how Head for Change hopes to change the narrative for footballers going forward. Head for Change works on 3 pillars, and 2 of them are particularly important when we consider the future. One is research and the other is education and advocacy. We at Head for Change consider that independent research is very, very important. It gives evidence of the reality of the dangers of head injuries in terms of the outcome of neurodegenerative disease. It identifies the dangers from concussion, from subconcussive hits, and also, crucially for footballers, from repetitive head injuries. Research can also be used to identify ways to minimize the risk of repetitive head injuries in training and in the game. And research is also important in order to ensure that players get the opportunity to optimize their health, both by following up on a regular basis health-related issues and taking due account of strategies that can help them to maintain good health. However, this research does not have any value unless it's actually translated into education, unless players know about it, unless they know what it means and how it affects them. So this knowledge has to be used to change certain things. We at Head for Change are working as advocates to have changes within the game, to minimise heading in training, to minimise heading in training, to ensure that concussion protocols are carried out on the side of the field, etc. But it's also important that the knowledge impacts players, and the players become particularly aware of how they can change their attitude and how they can change their behaviour. One of the things that's extremely clear is that young people, all of us, at an early age think that we're immortal. Nothing is ever really going to affect us. And there's a necessity for young players to recognise that what is happening to them at an early age literally has the potential to impact them 30 or 40 years on. And therefore, once that recognition is arrived at, there is a clear understanding that if you get a blow to your head, or if you feel dizzy from heading or whatever, then it's important not to carry on, to recognise that it's not macho to continue, but in actual fact, it's more wise to acknowledge the risks and try to take account of the advice that you're being given by the medics and cut down, go off the field if you're told to, and so on, not to try to play on. So in actual fact, if I summarise here, Head for Change wants to change the narratives for players going forward by getting more information, using research for all aspects of things that would benefit players. But then we want to use that information to educate players and educate sporting governing bodies to minimise the risks in training and in the game, and to educate players to take care as they play.